Welcome to the Omnidental Podcast.
Ready to dive in?
Today we are tackling a decision that sits right at the intersection of vanity, biology, and honestly, pure self-discipline. We've pulled a massive stack of sources, patient guides, clinical philosophies, research articles from Omnidental and MedSpa to answer that one question almost everyone asks eventually. How do I fix my smile without absolutely ruining my lifestyle?
It's the classic showdown, isn't it? The heavyweight title fight of orthodontics.
Yeah.
Traditional metal braces versus clear aligner.
Exactly. The old guard versus the disruptor. And usually people look at this as just, a purely aesthetic choice. They think, do I want metal tracks on my teeth or do I want invisible plastic?
Right.
But going through these sources, specifically the protocols from Dr. Bylis Polls over at Omnidental, I realized we've been looking at this all wrong. It's not just about looks. It's about biomechanics.
It is, and that is the mission for this deep dive. We need to move past that surface level. We need to really understand the rules of engagement for moving bone and tissue.
Yeah.
Because if you choose the wrong tool for your specific biology, it doesn't matter how good it looks in the short term. It simply won't work.
Okay, so before we get into the heavy-hitting debate, let's orient everyone. All our data today is anchored in the clinical approach of Omnidental and MedSpa. They're based in Arlington Heights, Illinois.
Right, 305 East Rand Road specifically.
And knowing that source matters here because Dr. Bylis Polls, the lead practitioner, isn't just an orthodontics guy. He's got over a decade of experience across general dentistry, cosmetic work, and even dental injuries.
That stood out to me in the notes. He handles trauma cases.
Yeah. When you see what happens when teeth are damaged, it probably changes how you approach moving them on purpose, right?
It changes everything.
Yeah.
And it means his priority isn't just straightness, it's structural integrity. The practice philosophy we're looking at describes a patient-first mentality and a dental journey.
A dental journey. I like that.
It implies that fixing your bite is a serious medical process, not just some cosmetic purchase.
So let's get into the ring. We have the heavyweight champion, traditional braces, and the modern ninja clear aligners. Visually, they could not be more different. But mechanically.
Mechanically, they are siblings. Maybe estranged siblings, but siblings nonetheless.
Explain that, because one looks like, a torture device and the other looks like a simple retainer.
Well, it all comes down to biology. Regardless of whether you use metal brackets or plastic trays, the physiological goal is identical. You are applying continuous, controlled pressure to the tooth.
Okay.
This pressure constricts the blood vessels on one side of the tooth, causing the bone to break down to resorb, and that allows the tooth to move. On the other side, new bone builds up to hold it in place.
So the destination is the same, the biological toll is the same, the difference is just the vehicle.
Exactly. And the choice of vehicle really boils down to two variables that I think most patients overlook: complexity and discipline.
Let's start with the heavyweight then. Traditional braces. In an age of AI and self-driving cars, why are we still gluing metal brackets to people's teeth? Why hasn't this gone extinct?
Because of physics. The Sork material calls them the workhorses for a reason.
The workhorses, okay.
If you look at the mechanics, a bracket bonded to a tooth gives you a handle, a physical handle that you can grab, twist, pull, and torque with a really high degree of force.
Which you need for the messy cases.
The really messy cases. We're talking about severe overcrowding, teeth that are rotated 90 degrees, or complex bite issues where the whole jaw alignment is off.
Wow.
If you need to pull a tooth down from the gum line, you need that grip. Plastic trays, they rely on pushing. Braces can pull.
That's a crucial distinction, pulling versus pushing. So if your mouth is a complex puzzle, braces are likely the only tool that can actually solve it.
They are the gold standard for a reason. They work for kids, adults, just about everyone. If structural perfection is the only goal, braces almost always win on reliability.
And it's a big, but we have to talk about the user experience. I'm looking at the list of cons here, and it's triggering some high school flashbacks for me.
It's not a subtle treatment, no.
First, visibility. You just can't hide them. For a 14-year-old, fine. But for a 35-year-old client-facing executive, that's a tough sell.
It can feel unprofessional to some, or maybe just youthful in a way they don't want.
And then there's the comfort issues. The sources mention soft tissue irritation. That's a very polite way of saying the metal shreds the inside of your cheeks.
Especially in the beginning, yeah.
Yeah.
You develop calluses eventually, but that first month is rough.
Yeah.
And then there's the hygiene aspect.
The spinach factor.
The spinach factor, exactly.
You eat a salad, you wear the salad for the rest of the day. The sources are pretty clear that cleaning becomes a major project. You're threading floss under wires between every single tooth.
It requires some real dexterity.
Uh-huh.
And if you get lazy, which, a lot of people do,
Yeah.
you end up with demineralization. That's where plaque sits around the bracket. It eats away the enamel, and when you finally take the braces off, you have straight teeth with little white squares on them, permanently.
Oh, that is a nightmare scenario. So you're signing up for what, 18 months to 2 years of high-maintenance hygiene and dietary restrictions? No popcorn, no sticky candy.
Exactly. You are a passenger on a very strict train. You can't get off, you can't steer, you just have to endure the ride until you reach the station.
Okay, so let's pivot to the challenger, the modern ninja. Clear aligners. The sources specifically mention Invisalign as the big player here.
Right. Custom-made, removable, clear plastic trays.
How do these actually work if there's no wire tightening things up?
It's a staged approach. Instead of one wire being adjusted over time, you get a whole series of trays. Let's say you get 30 trays. Tray number 1 pushes your teeth 0.2 millimeters.
Just a tiny bit.
A tiny bit. Then you switch to tray 2, which pushes them another 0.2 millimeters. It's like a flipbook animation. Each tray is a static frame of the final movement.
The appeal is obvious. They're virtually invisible. Unless someone is right in your personal bubble, they won't even notice.
And they are smooth. No metal hooks digging into your lip.
But here is the big insight for me. We talked about complexity for braces. For aligners, the defining variable is discipline. The sources mention something called the compliance trap.
This is where the marketing meets reality. The rule is simple, but absolutely brutal. You must wear the trays for 22 hours a day.
Let's just do the math on that. A day has 24 hours. You need them in for 22. That leaves 2 hours.
2 hours total.
For breakfast, lunch, dinner, any snacks, coffee, a glass of wine, and brushing your teeth.
That's it. So if you are a person who likes to sip a latte for 3 hours in the morning, you can't do that with aligners in, or you'll stain them and trap sugar against your teeth.
Or a grazer, someone who snacks all day.
If you're a grazer, aligners will drive you absolutely crazy.
That's a huge lifestyle shift. And the sources say if you don't hit that 22-hour mark, the teeth don't just stop moving, they can actually relapse.
That's the trap. With braces, the doctor is in control. The braces are glued on, the force is constant. With aligners, you are the doctor.
You are in control.
You are 100% responsible for the treatment. If you leave the trays on a napkin at a restaurant and throw them away, which happens constantly, your treatment just pauses. If you forget to put them in for a day, your teeth shift back.
So while braces are a train you can't get off, aligners are like a high-maintenance electric car.
That you have to remember to plug in every single time you stop. It's sleek, it's cool, but if you forget to charge it, you are not going anywhere.
But if you can do it, if you have that discipline, the benefits seem massive.
Oh, absolutely. The hygiene benefit alone is huge. You take the trays out, you brush and floss completely normally, no threading floss through wires. Your gum health is generally much, much better with aligners because you can actually clean your teeth.
And you can eat popcorn.
You can eat whatever you want. You just have to be diligent and brush before you put the trays back in.
Okay, so we have the trade-off. Braces are high visibility, high physical discomfort, but low mental load. You don't have to remember anything.
Ted, and forget it.
And aligners are low visibility, high comfort, but an extreme mental load. You have to be thinking about your teeth all day long.
That is the perfect summary. And there's one more factor: cost and limitations. Aligners can be more expensive because of the lab fees for making all those trays. And like we said, they have a ceiling. If your bite is truly terrible, aligners might not be able to fix it.
This brings us right back to Omni Dental and Medspa. Because looking at these trade-offs, I feel like I can't possibly make this decision alone. I can't look in the mirror and know if my bite is complex or just moderate.
You absolutely cannot. Self-diagnosis in orthodontics is a recipe for disaster. This is why our deep dive here emphasizes the consultation. You need data.
And the notes mention Dr. Poles uses advanced digital imaging. It's not just open wide.
No. They're looking at root structure, bone density, your jaw joints. They might look at you and say, listen, you want aligners, but because of how your lower jaw is positioned, we actually need to do braces for 6 months first. Then we can switch to aligners. You need a strategist.
I like that the source material describes the practice as a dental family. It sounds a bit like marketing fluff at first, but when you see they treat everyone from toddlers to seniors, it actually means something.
It does.
They aren't just a factory churning out one specific product.
And that context is vital. If you go to a direct-to-consumer aligner company, they only sell hammers, so everything looks like a nail. A comprehensive practice like Omnidental, which serves Buffalo Grove, Palatine, Schaumburg, that whole Northwest hub, they have all the tools. They can prescribe what you actually need, not just what they happen to sell.
Speaking of tools, I noticed a nod to sustainability in their About Us page. Being environmentally conscious in dentistry seems tough with all the disposables.
It is. But minimizing impact where safety permits is a value add. It shows a level of thoughtfulness that usually extends to patient care as well.
So let's try to land this plane. If I'm a listener sitting in, say, Mount Prospect or Wheeling, and I'm ready to fix my teeth, how do I actually choose?
You don't choose the tool first. You choose the commitment.
Explain that.
Ask yourself who you really are. Are you the type of person who loses their keys? Are you the type of person who needs a snack every 2 hours to function? Be honest with yourself. If you are, and you choose aligners, you are probably going to fail. You will waste thousands of dollars. In that case, get the braces. Embrace the metal. It's a safety net for your own habits.
And if you're the discipline type, the type A personality.
If you're organized and appearance is absolutely critical for your career or your confidence, aligners are a miracle. They disrupt your life far, far less provided you follow the rules.
It really does just come down to self-knowledge.
Yes. And trust. Trusting your guide. That's why that dental journey concept Dr. Poles talks about is so relevant. You're entering a partnership for 2 years. You need to trust that when he says this won't work with plastic, he's looking out for your long-term health, not just trying to sell you brackets.
So step one is getting that expert opinion. If you want to tap into that expertise, the source gives us a direct line. You can call Omnidental at 847-483-8833.
Or just book online. I think that's easier for most people these days. Just get the scan, get the diagnosis, stop guessing.
It's 305 East Rand Road in Arlington Heights if you want to map it.
Right.
As we wrap up this deep dive, I want to leave our listeners with a final thought.
Right.
We've spent all this time talking about the how, the plastic, the metal, the hours, but what's the why?
The why is almost countercultural today. We live in an era of instant gratification. We want Ozempic for weight loss. We want one-click shipping. We want filters on our photos. Orthodontics is one of the few things left that cannot be hacked. It takes time, 18 months, 2 years. It requires patience and a kind of biological respect.
You can't cheat biology.
You can't. And there is something profound about committing to a long process for a lifetime result. A healthy bite can prevent headaches. It prevents worn-down teeth. It can even change your facial structure. So don't get so hung up on whether you look cool for the next 18 months.
Focus on the long game.
Focus on the fact that you are investing in the next 50 years of your life. The method matters so much less than the commitment.
That's a great perspective. It's not about the train or the car. It's about actually making the trip.
Precisely.
Thank you for breaking all this down with us. It's been a fascinating look under the hood of a really common decision.
Happy to do it.
And thanks to you for listening. Remember, everything we discussed today is pulled from the source materials provided by Omnidental. We're analyzing the data, but we are not your doctors. For actual medical advice, go see Dr. Poles or your local professional.
Always get the professional consult.
We'll catch you on the next deep dive.